Hello, everybody. This is Gary. Today is Thursday, November 3rd, 2022. It is 1:36 p.m. Eastern Standard Time in the United States, in Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today I'm doing pretty good. It's a nice day outside. Nice day outside today. It's about 65 degrees out and it's sunny. I just went outside today to do some errands and pick up some prescriptions from the drugstore, from the pharmacy. Um, as far as my symptoms go today, they're not that bad. My paranoia is not that bad today. My delusions are not that strong. My auditory hallucinations are at a minimum. My depression and anxiety are not very strong today. Um, I did do some meditation this morning. Um, I'm still taking Clonopin 3 times a day for anxiety. I think that's why my anxiety levels have been down lately. Um, Today is the 3rd of November. I'm seeing my psychotherapist on November 7th. I've been seeing her every 2 weeks because as winter approaches, my psychiatric symptoms tend to get worse. Um, and I've been thinking it was better that I see my psychotherapist more often, like every 2 weeks instead of every 3 or 4 weeks. And I'm seeing my peer support specialist on November 10th. Um, she's somebody who has a mental health diagnosis that works as a staff counselor on staff at my mental health clinic. And I'm seeing her on November 10th. Um, my medications really have not changed at all over the past few weeks or months. Everything's pretty much stayed the same, except we did increase the Klonopin daily from twice a day to 3 times a day, half a milligram each time. Um, Not much else is going on. I did some work on my computer today. I do consumer surveys for extra money. Um, the holidays are coming up: Thanksgiving, Christmas, New Year's Day. I'm not exactly sure how I'm going to celebrate those holidays. I'm not a Christian anymore, I'm an atheist. So I don't celebrate Christmas as a religious holiday. If I celebrate it at all, it's only because it seems to be important to other people other than myself. Um, Thanksgiving, I'm not sure what I'm doing on Thanksgiving Day. I'll find some way to celebrate it. And the same thing with New Year's Eve. Um, I would like to point out that it's been a long time since I've been to the psychiatric emergency room. It's already gone past October 30th. A year ago on October 30th, I went to the psychiatric emergency room. Then I went again 3 months later, so that's just twice in 1 year, which is good because that's a new recent record for me. Before, I was going to psychiatric emergency once every once to twice every month for a while there. Um, but I've been doing better overall with my anxiety, my paranoia, my delusions, my hallucinations, my depression. Um, but I'm still keeping an eye on everything because winter is approaching. Another thing winter does is it increases the physical pain I have of arthritis in my upper spine, lower spine, some of my other joints. I had surgery on my right knee. The pain tends to get worse in the cold weather. Um, but other than that, my pain isn't all that severe. My physical pain has been under better control since I started taking Cymbalta, which is an antidepressant that can be prescribed for controlling physical pain, like nerve pain, muscle pain, joint pain. that kind of thing. I also take Flexeril for lower back pain and general muscle pain. Um, and I take Neurontin for physical pain as well. Those medications are all prescribed by my primary care doctor, not my psychiatrist. I'm not seeing my psychiatrist for another 5 weeks or so. Um, he didn't see a need for me to come in once every 4 weeks, so I'll be seeing him once every 6 weeks, unless some sort of emergency comes up. Um, but I've been sticking to my daily schedule and just keeping things as normal as possible.